Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Ebers, DHS Secretary-Designee Andrea Palm, and Dr. William Schwab, the chair of the UW Department of Family Medicine and Community Health. Also available to answer questions are Missy Hughes, the Secretary-Designee of the Wisconsin Economic Development Corporation, Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestoon, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Ebers.
Good afternoon, everybody, and thanks for joining us today. I hope you all had a safe and healthy weekend and that you continue to stay safer at home as much as possible. Even though things are opening back up sooner and more quickly than we had planned, it is still important to use common sense and good judgment to keep our families, our neighbors, and our communities safe. That means continuing to limit your travel and activities as much as possible, wear a mask in public if you can, and practice social distancing. For example, it is still a good idea to only go to the grocery store once a week and use curbside pickup and delivery options if those are available. And while you might feel comfortable getting together with friends and extended family, it's still a good idea to keep the groups you're in small and stay 6 feet apart. If we continue to make these kinds of smart decisions, we can still help slow the spread of this virus. Now, Wisconsinites have done an incredible job of banding together throughout this crisis, and it's even more important than ever for us to continue respecting each other, supporting each other, and holding each other accountable, and protecting those who are vulnerable. But as more businesses continue to reopen around the state, we need to go all in on doing this together, because we're all in Wisconsin. Earlier today, I announced $75 million in assistance for small businesses as part of the Wisconsin Economic Development Corporation's We're All In It initiative, a comprehensive effort to celebrate and help Wisconsin's small businesses get back on their feet and support best practices to keep businesses, consumers, employees, and communities safe. Funded largely by federal dollars received through the Coronavirus Aid, Relief and Economic Security, or CARES Act, this initiative will provide direct assistance to small businesses most impacted by the duration and restrictions of the COVID-19 pandemic. These $2,500 cash grants will assist 30,000 Wisconsin small businesses with the cost of business, with the cost of business interruption for health and safety improvements, wages and salaries, rent, mortgages, and inventory. Wisconsin small businesses have stepped up during this pandemic to keep people safe, and many have pivoted to producing needed items such as hand sanitizer and face coverings. Providing relief to small businesses in Wisconsin that have been impacted by the pandemic is an important part of our response to and recovery from the pandemic. Grant recipients will become We're All In businesses by committing to safety protocols and using them in their shops, cafes, and places of work to protect their customers, employees, and communities. This network of Main Street businesses will form the backbone of the We're All In It initiative, along with the support from major Wisconsin businesses, communities, and other associations. These grants will help businesses in the short term, and we need Wisconsinites to join our long-term economic recovery by supporting those small businesses as patrons and customers. We know that folks need to feel safe and confident as employees and consumers for this to work. So that is why we need to be all in it together. And as more folks are going back to work, we need to make sure that childcare is affordable and accessible for working families, and that our providers have the tools and information they need to care for our kids safely. Childcare availability, affordability, and quality plays a critical role in a healthy economy. As another component of our state's CARES Act funding, the Department of Children and Families has been approved to begin a $51 million payment program to support Wisconsin's early care and education community. The Child Care Counts COVID-19 Emergency Payment Program is broken into 3 smaller programs targeted at the most common circumstances early care and education providers are facing in the wake of this public health emergency. This program is a testament to the positive impact we can have when we work together. Throughout the process of creating this payment program, we made a concerted effort to incorporate input and advice from early care and education providers and stakeholders, legislative leaders from both parties, and members of the Joint Finance Committee. As a result, we have a program that addresses nearly the universal desire to help early care educators by supporting the costs of providing care for essential working families, offering incentive pay for child care providers and individual educators, and assisting providers who were forced to close with the costs associated with retaining staff and reopening child care programs. The department is issuing payments across 3 application periods, beginning today, May 18th through May 29th, June 8th through June 19th, and June 29th through July 10th. I encourage folks to visit the DCF website at dcf.wisconsin.gov to learn more and apply today. Now, we're really excited about both our Child Care Counts program and the We're All In It initiative. It just goes to show that when everybody comes together, we can make things happen. I will continue to work hard every day to put the people of Wisconsin first in our state. I know that you will continue to do your part as well by making good decisions like staying home when you can, practicing social distancing, and wearing a mask in public. I also urge anyone who needs a test to go get tested at one of our community testing sites and help protect your community and family from this virus. We're still working to offer community testing throughout the state, partner with local public health officials on contact tracing efforts, and procure additional PPE. It's also still important to reach our goals in these areas. I know that if we do it together, we can box in this virus and get back to our Wisconsin way of life. I'd also like to take a moment to say thank you to our local public health departments around the state. These folks continue to work hard with limited resources to keep our communities safe and healthy. So please join me in thanking your local public health officials and let them know you support their work to keep our communities safe. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like to let you hear from one of the healthcare workers on the front lines, Dr. William Schwab, Chair of the UW Department of Family Medicine and Community Health. Dr. Schwab?
Thank you, Governor, and good afternoon. I'm Bill Schwab, a family physician who practices at the Northeast Family Medical Center in Madison. I also serve as interim chair of the Department of Family Medicine and Community Health at the University of Wisconsin School of Medicine and Public Health. I'm proud of my profession, proud of my department, proud of my specialty of family medicine, proud of our medical school, and proud of my clinical organization, UW Health. It has become a cliche to say that our healthcare delivery system has been completely transformed over the past 2 months, but it is accurate, and it has been stunning in scope and speed as we have implemented this rapid transition to a completely different model of care that fits the needs of a society suddenly dealing with COVID-19. At the hospital level, frontline physicians, nurses, and other staff have not only faced the challenge of urgently learning all they can about an entirely new medical condition, but also how to provide care in new ways that are safe for patients, their families, our communities, and themselves as healthcare workers. No less significant is what we've done in primary care. The ongoing and acute medical needs of our citizens did not abate because of the presence of a pandemic. People with diabetes, hypertension, heart disease, and lung disease still need attention to their conditions. Prenatal care and well-child care with immunizations are still essential for the health of mothers, babies, and children. Injuries and acute illnesses are still happening, and depression, anxiety, addictive disorders and other behavioral health issues are not only still present, but increased. As COVID-19 first entered our midst, there was considerable uncertainty about safety issues for our patients and our staff, which led to canceling almost all office visits, as well as minimizing procedures and other hospital-level services. In our practices, we switched to alternately providing care through structured telephone visits, and in recent weeks, that has been supplemented by a marked increase in the use of video visits. These sudden changes have not been without cost. The irony in healthcare is that we have worked extremely hard to prepare and transform in ways that have actually had the secondary effect of dramatically reducing revenues and increasing expenses. And this has had major adverse impact on our workers and their families. But the costs have been high in other ways too. Delayed or deferred medical care may have long-term adverse effects, and the emotional stress for some has been exceedingly high. And all of the evidence is showing that there is unequal distribution of viral infection, of access to technology for alternate modes of care, and of economic impacts in communities of color and among people with disabilities in our state and nation, perpetuating and exacerbating already existing significant health inequities. But the greatest impact has been on people who have dealt with infection and on their families. I know this personally. On April 17th, my mother celebrated her 94th birthday. On April 18th, she was diagnosed with COVID-19. And on April 28th, she died at an assisted living facility in an adjacent state. A nurse here in Madison for nearly 30 years, her burial was attended by just 10 people who exercised the necessary precautions in this extraordinary time. Her family of 30 children, grandchildren, and great-grandchildren could not all be in attendance, nor could her large extended family and the many friends who had known her. Despite our depth of mourning, we all know this was the right thing to do at this time, yet it was still dispiriting. No one at her residence wanted to cause her to get sick. She was loved there. The facility followed all of the precautions that were understood at the time and provided attentive and tender care until her last breath. But we live in a microbially shared world in which your microbiology is my microbiology. And that was regrettably the case in the facility where my mother lived, as the microbiology of someone else who had been in contact with others became hers and ultimately led to her death. I can attest that COVID-19 is very real and that it can be devastating. More will be learned that will enable us to function better as a society as we make the transition we have currently embarked on from acute crisis status to chronic pandemic mode. But much will also remain unknown. In healthcare, we have learned enough about how to maintain safety for all to be able to resume offering services at our offices and hospitals in addition to the expansion of telemedicine. This requires knowledge, planning, and protective equipment. That same level of awareness will need to be scrupulous and universal across the breadth of our society if we are to maintain the necessary margin of safety. As I said at the beginning, I take great pride in what we in healthcare and at the University of Wisconsin School of Medicine and Public Health are doing. I can assure you that those of us in family medicine and other primary care specialties are committed to continuing to serve our patients with the highest level of care, regardless of the modality used to provide that care. And we will continue to partner with our colleagues in public health to promote the safety of the people of Wisconsin. It is said that statistics are human beings with the tears wiped off. I understand well the importance of statistics, and I have also experienced personally the tears that are embedded within them. My hope is that with the collective effort to maintain physical distancing and to follow other related recommendations, we can continue to have substantial viral control in our communities, and we can reduce hardship and deaths in our state. Thank you. And now I'll send it back to Secretary Designee Andrea Palm.
Thank you, Dr. Schwab. You certainly have our condolences, as well as all of our Wisconsinites who have lost someone to this disease. Thanks for joining us again today, everyone. In light of the uncertainty and confusion caused by last week's Supreme Court ruling, I want to take just a moment to remind Wisconsinites that our work and our mission at DHS remain the same. We are committed to protecting and promoting the health and well-being of the people of this state, and we will continue to rely on our public health experts and scientists to keep you informed on the best ways to stay safe and healthy, just as we have done since the beginning of this pandemic. DHS continues to work with our partners across the state to increase our testing and expand our contact tracing. We continue to work with local leaders to help ensure access to safe isolation, shore up our hospital capacity, and monitor the prevalence of COVID-19 in communities across the state. We put together a strong plan based on the science of the virus and the fact that a gradual process is the safest way to reopen Wisconsin. That has not changed. The science has not changed, nor have the recommendations of our public health experts. I know there are questions that folks have and that weigh on their minds as they try to decide how to move forward. Should we still stay at home? Our best public health advice is yes. You are safest when you are at home. Can you safely visit with friends? Yes. Our best public health advice is that we recommend you do that virtually. Make a phone call, set up a video chat, send a note by mail. Can you take trips outside your house? Absolutely. But our best public health advice is that you should, as the governor suggested, continue to limit them as much as possible to your essential trips, like grocery store and pharmacy on your weekly basis. Can you go out to dinner? Our public health experts recommend that you continue to enjoy a meal from your favorite local restaurant via pickup and delivery, but not to dine in. Our public health reality has not changed. This virus remains very contagious, and our data and metrics tell us that we should continue to limit our interactions with others as much as possible to protect ourselves and our communities and to reduce the spread of COVID-19. At DHS, our mission has not changed. We continue to do the work to protect and promote your health by giving you guidance based on the best science and public health practices available. And we continue to share the data on where things stand here in Wisconsin. So let's move to our daily numbers. We have 52 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 13,392 tests. We have 144,502 negative tests, which is an increase of 4,828 over yesterday. There are now 12,687 confirmed positive cases of COVID-19, an increase of 144 over yesterday. And our total deaths here in Wisconsin have reached 459. We currently have a total of 299 facility-wide public health investigations that we are involved in. The data has always informed our decisions and guidance, and that is not and will not change. Thank you for your continued partnership as we respond to this pandemic together.
And thank you. We'll now open it to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, only one question per reporter per media outlet. We'll begin this afternoon with Addie Bink from WFRB TV in Green Bay. Addie?
Hi, thanks for taking my call. So my question, I believe this is for you, Governor Ebers. Last week we saw a ton of counties go back and rescind their safer at home orders. Can you tell me at all what sort of guidance or any guidance that maybe DHS gave counties regarding reopening or a safer at home order in their counties?
I think I can answer that question. So this is Ryan Elsastoon. I think the question was focused on guidance the state has provided to local health officers and officials following the Supreme Court's decision. And I think it raises a good point that, the decision by 4 justices of the Wisconsin Supreme Court has, created massive confusion and chaos, around the state. And, that's the problem with a decision that departed from past precedent, is there can be chaos and unintended consequences. We do believe that local health officers, can and should take steps to protect the people of Wisconsin from this deadly virus, that they do have the authority to issue orders. And on Friday, Attorney General Josh Kaul issued an Attorney General's opinion laying out guidance for local health officials on how they can issue these orders following the Supreme Court's decision last week. In addition to that, the administration has we put out a template actually earlier today that local health officers can use to base their decisions on when they're trying to put these orders into place. And that said, I think everybody understands and appreciates the difficult position this puts local public health officials in, where not only are they on the front lines of dealing with this virus, but now they're also at the front lines of the legal fight over what, if anything, the state can do in order to mitigate COVID-19.
Thank you, Addie. Now to Casey Nelson from WTIQ Radio in Green Bay. Casey?
Hi, thanks for taking my call. As you work on new programs and new steps towards safety, what is really kind of the process and the details of putting together health orders like the Safer at Home order was put together, and then any plans that you have to put together maybe some kind of new guidelines going forward? What's the process of putting those together? Thanks.
Well, the guidelines that we've put together, and actually several of the counties reference, and also they're part of our CARES package that I talked about today, were developed by the WEDC in conjunction with the business community, along with Department of Health Services and stakeholders across the state. And those guidelines they've done a great job. They're very complete and comprehensive, and we believe of a high quality. And that's how those guidelines were created, and that's how we'll continue to do that.
Thank you, Casey. Now to Michelle Melby from WLUK TV in Green Bay. Michelle? Michelle Melby from WLUK TV. Okay, we'll move on then to Ben Jordan from TMJ4 in Milwaukee. Ben?
Hello, it's Rachel Bloshin for Ben. Governor Ebers, how do you think the DNC should be held this summer out of these three options? In-person, hybrid of in-person and remote, or virtually, and why?
I'm sorry.
Something else.
I didn't. You broke up. I didn't know I didn't hear your three options, but I'll answer the question nonetheless. And that is something for the DNC, along with the city of Milwaukee and others to weigh in on. I'm hopeful that there's a convention, whether it's virtual or not. That's yet to be determined, but I think it's important to have it. That said, I know the party is committed to doing it in a way that does not cause more stress on the healthcare system in southeast Wisconsin, and they want to do it safely. The public health is a top priority. So I think it's a work in progress. I'm not involved with making that decision. And when they ask me, I encourage them to make sure that there is a convention this year.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my question. I was wondering, could you provide an update on contact tracing efforts, including the hiring of additional contact tracers, and any concern about the state not being prepared with that expansion of contact tracing as it reopens? Thanks.
Thanks, Sean. So we have made the first 100 offers out of the process that we talked about last week, where we interviewed somewhere around 400 folks. We have made the first 100 offers. 26 of those are onboarding today and starting training, and will be deployed as soon as that training is complete. We obviously will continue to onboard folks, and as needed, as needed, we'll certainly reopen that application process if we need additional potential candidates for us to screen and consider. I think you raise an important question, Sean. We are working as quickly as we can to deploy contact tracing assets and working with our local public health partners to understand where those needs are and to be strategic as we understand more about the current state of the disease in Wisconsin, where outbreaks are happening, and therefore where additional resources might be needed in the short term as we continue to ramp up the larger infrastructure that's necessary to allow us to do this contact tracing work moving forward. But we certainly are moving as quickly as we can to make sure that we are doing everything we can to do these contact tracing interviews as efficiently and as quickly upon understanding a positive test result as we can.
Thank you, Sean. Now to Jason Kelvey from Fox 6 in Milwaukee. Jason?
Thank you for your time. I want to come back to the question on the convention for the governor, please. The DNC chair says he is working closely with Wisconsin officials so they don't put people in harm's way. So can you explain what your recommendation is on the DNC?
Well, I haven't been asked my recommendation. I want the Democratic convention to happen, but I also want to make sure that there isn't a stress on the public health system in Milwaukee, nor put the delegates and others that come to the convention in harm's way. So I guess saying that, I would believe it's likely that it would be virtual, but I want to see the data before I give any recommendation. But for sure, we need to have a convention.
Thank you, Jason. Now to WISN TV in Milwaukee. WISN?
Sorry about that. Is the state monitoring the inflammatory syndrome in kids, and have you found any cases yet here in the state?
Mm-hmm.
Yeah, this is Ryan Westergaard. I can respond to that. So the multi-system inflammatory syndrome in children is a new disease process that's not fully understood, that was initially described in the United Kingdom of patients who had patients under 18 who had disorders in multiple organ systems, the heart, the lungs, low blood pressure, that is similar to a known disease called Kawasaki syndrome. And there was a cluster of these cases that seemed to be similar in time, and they all were positive for COVID-19. So there's sort of internationally been a call for clinicians to keep their eyes and ears open for similar patterns so we can learn more about those. Last week, the CDC gave a notice in terms of a case definition, so listing the specific criteria that could fall under this umbrella of people who might be suspected to have this. So here in Wisconsin, we are sharing that information with all our clinicians and asking them to report, and we've sent out a health alert network with a standardized case information reporting form. So to date, we have not had any confirmed cases of this new entity, but since it's so new and we're just developing the case definition and the case information, we're sharing the news widely that hospital providers should be on the lookout and report it to the state when and if they do see any.
Okay, thank you. Now to Emily Fannin from WKOW-TV in Madison. Emily? Emily Fannin?
Hi, can you hear me?
Yes.
Yes, thank you. Your administration and the DHS has withdrawn its outline for the new emergency rule or the DHS scope statement that it put out after the Supreme Court ruling. What does this mean? Why did you come to that decision? And what is your priority moving forward, if not to reinstate elements of the Safer at Home order?
Well, the Republicans made it very clear that they don't believe a statewide approach is the right way to go at this point in time, and they also don't believe that any restrictions are advisable at this time. So that kind of narrows it down. And they rejected our scope statement. So given that, we will it just doesn't make any sense to spend a lot of time doing something that we know isn't going to be successful. That said, we will continue to meet and talk about things that are important to the state as it relates to this. I'm sure we'll continue to talk about the WEDC guidelines and how we can hopefully have good participation in those guidelines going forward. But as far as an administrative rule process that frankly was going to take forever and nothing was going to happen, because what we were hoping to do is provide some guidance as it relates to surges, and we were unable to get agreement on that.
Thank you, WKOW. And now to Ryan Burke from Spectrum News 1. Ryan?
Yes, good afternoon. We're now about 4 or 5 days away from the kickoff to the Memorial Day weekend, traditionally one of the busiest travel weekends of the year in the state, and the first one where we won't have statewide Safer at Home in place. Are there concerns about the increase in spread potentially over the weekend, and is there any guidance you're offering to communities where people do tend to come and gather?
Well, just what I think all of us have said probably every week at these events, or at least a couple times a week, and that is keep social distancing at 6 feet, making sure that it is helpful to wear masks, so wear masks, and make sure that you're comfortable in the situation that you're in. It's clear that there might be some situations that you're thinking people are standing too close together, people are without masks, and therefore I'm out of here. I'll go back home. So, I think I understand that the decision that the Supreme Court created, and that's the law of the land. But at the same time, I know Wisconsinites have lived here for 68 years, and they have good common sense, and I think they will follow their minds and their hearts to do the right thing during this busy Memorial Day weekend. Additionally, you can celebrate Memorial Day in your backyard as well as you can driving 500 miles someplace. So we just have to use our common sense, and that's what I would suggest.
Thank you, Ryan. Now to Heather Poltrock from WSAW-TV in Wausau. Heather?
Hi, thanks for taking the call. I was wondering if you could give us an update on the nursing home testing and just talk to me about what the standards are for nursing home patients that do not consent to a test, whether they are asymptomatic or don't have any symptoms, or if they do have symptoms and are not consenting.
So we are in active conversations with nursing homes across the state, many of whom have already submitted requests for testing supplies, which we obviously are sending them at no cost. Others need some additional staffing assistance to administer those tests. So again, we continue to talk with them about how we might meet those needs. But it is our goal over the next number of weeks to provide access to testing for all staff and residents in long-term care facilities in this state, and will continue to do that. We obviously this is voluntary. If folks do not wish to be tested, they can certainly decline to do so. But it is certainly our public health recommendation that testing is universal, so that we can truly understand whether the residents and staff in that facility are safe. To your point about many folks are asymptomatic, so we want to make sure that we're testing everyone so that we have a baseline understanding of what is going on in each of these facilities.
Thank you, Heather. Now to Ben Meyer at WXPR Radio in Rhinelander. Ben? WXPR? Okay, we'll move on then to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick? And a reminder, *6 to unmute your phones. Patrick Marley from the Journal-Sentinel. Okay, we'll move on
Hi,
then.
Governor.
Go ahead.
Governor, I wanted to ask about these grants for businesses. It looks like they have to comply with some kind of, or comply with the Badger Bounce Back Plan. Is the effort there to try to get that in place as much as possible after the state Supreme Court ruled against the stay-at-home order?
Is Missy still on? Missy, you want to talk about the We're All In program?
Hi, this is Missy Hughes. The We're All In plan is asking businesses to commit to keeping their employees and their customers and their community safe. There is not a requirement to comply with the Badger Bounce Back Plan. Obviously, as Secretary Palm and Governor Evers have described, we will continue to watch gating criteria, and businesses should keep their eyes on that in order to make the best choices for their communities and their employees and their customers. Our hope is that everyone will work together to assure that we continue to stop the spread of COVID-19, because that's going to be critical for the recovery of the economy. If we have to step back, if we have surges or hotspots, that's going to undermine worker confidence and consumer confidence. So it's really important that we're all in this together, we're all working together, and that is our goal of the We're All In initiative.
Thank you, Patrick. Now to WBAY TV in Green Bay. WBAY. WBAY TV in Green Bay. And a reminder, *6 to unmute your phone. Okay, we'll move on then to Denise Lockwood from Racine County I. Denise?
Good afternoon. So my question is around the capacity. So Racine County, it has about 39 ICU beds, but we really don't know how many of those are available. And that's largely because the bed capacity and availability numbers are only broken down by region. Are there any plans in the works that bring that data down to a county level?
So our surge capacity and surge planning efforts done by local health systems and local communities are not, I guess I would say they're not really at the county level, right? There are opportunities across regions, across systems to understand surge in a broader context. And so I think it's an artificial boundary, I think, to talk about counties, but we've been working very closely with local health systems around the state to make sure among the systems in those regions that they have the capacity that they need should they see a surge, and that we have our alternate care facility in the southeast part of the state, which could serve as backup to any part of the state that exceeds its capacity, and obviously we did that with the thought in mind that if we were to see parts of the state exceed their hospital capacity, that having this Plan B, this alternate care facility as backup to the surge plans that local health systems have in place, that was a really important piece of work that the state could do to support communities all across the state.
Thank you, Denise. Now to Steve Prestegard from the Platteville Journal. Steve?
Excuse me. Thanks for taking my question, which is, there was a report, and I'm not sure of the source, that the UW system intends to restart classes as more or less usual this fall. So my first part of the question is that correct? And secondly, does that have any impact at all on whether or not schools, K-12 schools, start as scheduled this fall also?
Well, yes, this is Governor Evers. I saw that on actually a report on TV that is their hope to start this fall UW system. I know the report talked about the system is committed to testing every student before school begins. And I think it's still a work in progress. In the K through 12 world, we're working with State Superintendent Carolyn Stanford Taylor and also people at the local level to come to some consensus around this. Now, I will say, just from my vantage point, and this isn't gospel, it's just my belief, is that I think as we look at this, we have to look at as a goal to be open this fall in the most regular way as possible. However, we also have to look at the science and make decisions based upon that also. So I think having both systems look at things that we do want to bring children back to school in the K through 12 world and have higher education operate. We will look at what that means and whether that will satisfy the healthcare concerns. But decisions haven't been made, but I think a reasonable starting place is to try to reach yes, and if that's not the place, then we have to come up with different alternatives.
Thank you, Steve. Now to Ryan Curry from NBC 26 in Green Bay. Ryan?
Hi, good afternoon. My question for the administration, as businesses start to reopen, would the administration consider any additional action or orders in the event that cases may spike as a result of more people being out and about?
I think I can probably answer that question. So one of the things that is difficult about the Supreme Court's decision is that it didn't provide a lot of clarity in terms of what can be done going forward. We issued a number of orders, and the Supreme Court said that had to go through rulemaking, but they didn't provide any clarity in terms of what those rules can pertain to or exactly cover. And now with opposition to the scope statement and that being pulled back, the only real viable option I see at this point is for the legislature to meet and pass legislation that either addresses what the guidelines are going forward in case of a surge or specify what authority DHS or local health officials have.
Thank you, Ryan. Now to Todd Richmond from the Associated Press. Todd?
Hi, can you hear me?
Yes.
Hi, can you hear me?
Yes, we can.
Governor, to clarify, so there's going to be no further attempts at any kind of a statewide administrative rule? Is that what I heard you say?
Correct. Yes, they said no to anything other than what exists. They didn't want to do anything on a statewide basis, period. They didn't want any more restrictions, period. And so, given those two facts, what we're left with is what the Supreme Court decided, and so we'll continue to meet and talk about different things. I'm not saying this is an end of conversations, but as it relates to the rulemaking process, it's not worth our time. We already know where they stand, and they control that process.
Thank you, Todd. Now to Stephanie Hoff from WIS Politics. Stephanie?
Hello. Thank you for holding this call. Why is DHS still tracking metrics of the Badger Bounce Back plan?
So I think, Stephanie, as we've talked about, the virus remains the same. Our work remains the same. The things we need to do together to protect the health and safety of the people of this state remains the same. And those metrics help us understand where we are in this disease, whether we're going in the right direction, whether there are indicators that things are backsliding. Those are all baked into our metrics and our data. And so we will absolutely continue to post those, to keep them updated, and to encourage folks to use them to make good decisions about the way that they interact with each other moving forward. And so I think it's a critical part of being informed as a state about where we stand, where we're headed, and how we need to behave together moving forward.
Yeah, and those metrics are more important today than ever. Given the circumstances we are in, they're important metrics for all of the state to take into, as Secretary Designee Palm said, it is important for people to understand where we stand on those metrics, and so that we can find out where we're having problems and where we're having successes.
Thank you, Stephanie. Now to Riley Vetterkin from the Wisconsin State Journal. Riley?
This question might be for Dr. Westergaard. From the data you have now, is it looking likely that Dane and Milwaukee counties should be extending their safer at home orders past the 26th of May? Thanks.
Well, I think as the governor and the secretary just said, the data give us a snapshot of what's going on in the overall community. And the other thing that hasn't changed, in fact, we're continuing to learn more about, is the role of community-wide mitigation measures. You know, globally, there's pretty good evidence, pretty good trends suggesting that communities that have restricted physical distancing have put a dent or flattened their epidemic curve. So those things remain in effect, and the data that we're seeing at the county level are good metrics to be able to use to have those discussions and make those decisions. I think there may even be additional metrics that we going forward that have to do with numbers of ill people with respiratory symptoms that we can get from different sources, from electronic medical records. And going forward for the next summer and into flu season, I think having those decisions, where they're a result of a law or a public health order, or it's school districts and groups of businesses making the decisions to do these community level interventions like closing businesses or closing schools, we're going to have to make those decisions based on data that's evolving over time. So right now, Milwaukee County and Brown County, and to a lesser degree, Dane County, are still having low-level community spread. And what we know about the virus is that unless we have really robust intelligence about knowing exactly who has the virus, who they've been contacted with, and resources to support people in isolation and quarantine in those conditions, until we can do those very comprehensively, the community level mitigations like social distancing and limiting gatherings play a really important role. So those three counties are where and also Racine County, that would be the fourth, are where the bulk of our cases are and where we think community transmission is happening. And in the absence of really robust information about where the disease is specifically and medical countermeasures like medications and vaccines, as long as we don't have those, it's a good idea for communities to be thinking about continuing these things. So the government to make their decisions about whether these are rules or whether they're recommendations to organizations, but I think the conditions on the ground with the data are that physical distancing right now in a number of Wisconsin communities is still a very valuable way of reducing transmission in the community.
Thank you, Riley. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. How does contract tracing change, and to what extent does it, or will it, take into account the change in circumstances following the 13th? Will contract tracers be instructed to ask specific questions about behavioral changes since that date in order to see whether there's an association with a new spike in infections?
So I can talk about contact tracing in general. But one thing I think important to understand is that we're not starting contact tracing for the first time here. This has been an activity that local public health professionals have been doing for decades, and it's part and parcel of the work that they do every day, and they've been doing it during this pandemic. The reason that we're talking about scaling up contact tracing is because, when the pandemic started, local public health departments didn't automatically get 100 times more contact tracers, even though the number of diseases needing investigation went up by about 100 or more. So we already know a lot about how to do this. We have a lot of expertise locally to do this, and the protocols are well established. So the key for contact tracing interviews are really to understand exposures to other people who might be at risk, and then so allow us to go support and give information and education and support for those interventions. We don't ask or care so much about individuals' behavior. This is contact tracing, like as much as we do in public health, is really supposed to be non-judgmental and honest and transparent and supportive. So we don't care so much about why people are exposed. What we care about is getting good information about who is exposed to people who might have COVID-19, so we can support and get them protected in their communities.
Thank you, Eric. Now to Lee Mills from NBC 15. Lee?
Hello, thank you for taking my call. It's two-part. First, I just wanted to kind of talk locally, specifically let's use Dane County as the example. For people who are living in a place with essentially the same rules on a local level that we saw in your Safer at Home order, Governor, who might also have a place up north or the opportunity to do their traditional Memorial Day holiday celebrating. I know Andrea specifically addressed and said, here's our recommendation, you know, can you get together with friends, et cetera. But I'd like to hear your advice to people who live in a county where they still have these same rules in place, but might have the ability to go somewhere else where those rules don't exist. What would you say to those families who are contemplating their future plans for the weekend? And are you worried heading into the holiday weekend?
There's a couple questions there. Of course, anytime we have a holiday like Memorial Day, for example, even outside of the pandemic world, last year, Memorial Day, we worried about having a lot of people on the road and having difficult outcomes on the highways. And so it's always a worry. And the leaders in the counties that have kept Safer at Home in place did it for the same reason we had Safer at Home, and that is you contribute not only to your own safety, but you're contributing to the safety of others in that county. And if you leave the county, then that changes the dynamic. So I support the folks that have kept that Safer at Home order going, and I would hope that people wisely do not travel in excess, because by doing so, you create more opportunities for the virus to be spread.
Thank you, Lee. Now to Jeremy Janine from Urban Milwaukee. Jeremy.
Governor, there's a letter going around on social media that you're proposing to institute a 150-day shutdown with a possible, I think it's a 120-day extension. Can you address that?
That'd be a lie.
Thank you, Jeremy. Now to Jessica Van Egren from Up North News. Jessica.
Yes, thanks for taking my call. I just had a question, a bit of clarification actually, in regard to the Supreme Court ruling. So just to be clear, say after the Memorial Day weekend coming up that we do see a surge, possibly, let's just say in Door County, what, I guess, am I understanding this correctly, that there would not be a way for the state to respond to that surge? There wouldn't be like a coordinated effort on the books anymore?
For sure there would be. We would provide whatever support would be necessary, whether it's testing, whether it's contact tracing, whether it's equipment, whether it's support. Yes, we would. It's just like we operate now, and that was not changed by the Supreme Court.
Thank you, Jessica. Now to Mason Dowling from WAOW-TV in Wausau. Mason? Mason Dowling. Okay, we'll move on then to Jonah Chester from WORT Radio in Madison. Jonah.
Hi, thank you for taking my question.
Outside of the legal guidance offered by AG Call's opinion, what additional support is being provided to counties who have decided to implement their own safer-at-home orders?
Sure, I can answer that question. This is Ryan Elsestuen. So in addition to the AG opinion, which I think is a very useful tool for counties and local municipalities to use when deciding how to put in place a local order, the administration has also shared a template with local officials that can be used as a starting point that's consistent with the Attorney General's opinion. In addition to that, the administration we have regular calls with public health officials on a daily basis, answering questions and providing support. We recently did the same thing with a call with Wisconsin Counties Association, the League of Municipalities, and those are types of outreach and efforts that we're going to be continuing doing because, as I mentioned earlier, now with the Supreme Court ruling, local public health officials have been on the front lines of this from the very beginning, but now they're also on the legal front lines as well. And so we'll be continuing to providing information, guidance, and support so that they can do their jobs as best as they can.
Thank you, Jonah. Now to Maddie Heim from USA Today Network, Wisconsin. Maddie.
Hi, thanks for taking this call. So just looking at today's percent positive, it looks like it's about 3%, which I believe is sort of the lowest that it's been at least this month. And I'm just wondering, do you think that's something that we can look to as a positive sign, or could there be other mitigating factors that make it that low, or, how should we be interpreting that?
Yeah, I can address that. So when we look at the total number of new positive cases that have really for the past month, it's been a pretty flat curve. It's a wavy line, but we've gone between, I think it was 145 today. As recently as Friday, we had a high day of about 500, and the average has probably been pretty flat between 300. So the number of cases we're detecting is staying about the same. The percent that are positive out of all the tests really determines how many tests are being done overall and who are the people being tested. So it depends a little bit on where the tests are being deployed, if it's among asymptomatic people or symptomatic people. So I think the short answer is yes, it's an encouraging sign, because if we doubled the amount of tests and we saw double or more the number of positive cases, that would be a bad sign. So it's good that we're not detecting more and more cases as we test more. Does it tell us for certain that transmission is slowing down? It doesn't really, because those things happen locally, and we're continuing to test or sample a pretty small fraction. So the percent positive, like all of our numbers, are one piece of information from one perspective that we look at, and we won't read more into it than it is. But the short answer is yes, we like seeing a lower proportion rather than a higher proportion.
Thank you, Maddie. Now to Will Cushman from WisContext. Will?
Good afternoon. I am curious about one aspect of contact tracing. I understand after talking to some local health officers that there are some formulas that are floating around for kind of helping guide how many contact tracers may be needed in a certain geographic area. And I know that the Association of State and Territorial Health Officers or Officials has also released some guidance based on population sizes for how many contact tracers are needed. And I'm just curious about where the state has gotten its estimates for the number of contact tracers that may be needed in the coming months.
Well, I'd say the best source of information of how many are needed are from our partners in local health departments, because they are the front lines of investigating every case that is diagnosed, which then requires an investigation because it's mandatory. All COVID-19 cases are reportable, and every single case needs an investigation to understand who they've been in contact with. So the workforce needed is the one that is sufficient to make sure that every single case gets that in a timely fashion. And that's something that we need to collect data on and follow as closely as a metric. As I said before, the workforce that's doing this under normal conditions is highly trained and able to do this, but they also do this for a large number of other communicable diseases. So since the new pandemic has taken, it's really taken everything off of their plates. So we've had to make surge capacity at the state level to answer backup, people who have a list of phone calls that needs to be made. But there's no getting around the fact that local health departments need to be able to respond to every single case, and we don't know exactly how much that is until we collect the data and see how many people are getting cases and how many of their contacts are getting contacted. So our goal is based on what is feasible to stand up in a short period of time, but it's likely to change over the next 6 to 12 months as the epidemic changes. We feel like we need to have a workforce that can flex and be where it needs to be so that we have really a complete coverage of all the cases wherever they are.
Thank you, Will. Now to Taryn Powell from Milwaukee Public Radio. Taryn?
Hi, can you hear me?
Yep.
Yes, thank you for taking my call. I wanted to ask Governor Ebers if you are aware of the lawsuit that was filed on behalf of a couple of Wisconsin voters and other organizations, just saying that they believe that, and it's against the Wisconsin Election Commission, saying that they think voting protocol needs to be changed going into the fall. Otherwise, like, their constitutional rights are being violated because everyone hadn't been able to vote. What are your thoughts on that, Governor Evers?
Well, I'll let Ryan Nilsen give the legal answer, but yes, obviously I was concerned about that because I asked the Republicans to change the date, and then feeling that, I asked the Supreme Court to change the date. So I think, generally speaking, having an opportunity to make voting easier is more important than making it more difficult. But the lawsuit, Ryan, I'll talk
Yeah, I think it'll be interesting to see what the federal court does with the lawsuit. That said, one of the things the administration just did recently was calling on the Wisconsin Elections Commission. They have federal funding available in order to make voting easier and especially address the difficulties of doing an election during a pandemic. We went to fairly great lengths in order to try to provide support during the April election, then during the special elections in the 7th Congressional District, but it's also now time to start thinking about the August primary and the November election, what we can do to make sure that voting's safe and accessible for all. And one of the best ways we can do that, just like we saw during the spring election, was to have people be able to vote absentee. Clerks under state law can send out an absentee ballot application on their own. There's funding available that the Wisconsin Elections Commission could use in order to cover those expenses. And it seems to me one of the most sensible, safest ways we can expand voting in the state and do it safely during the COVID-19 pandemic is to mail absentee ballot application to everybody so that there's time for them to be able to vote safely and securely.
Thank you, Taryn. Now to Mark Stevens from CBS 58 Milwaukee. Mark?
Governor, going back to the $75 million, you said it could help up to 30,000 businesses. And looking in the details, that was for businesses with under 20 employees. Looking at census data, there's about 91,000 of those businesses in the state. How is your administration trying to help the remainder who may not be able to get that share of the money?
Secretary Designee Hughes, do you have a response for that?
Yeah, the focus that we're going to have on the businesses that are being receiving the $75 million are going to be the retail and restaurant industry, the hospitality industry that's been most impacted for the longest duration of the COVID-19 crisis. And obviously there's many businesses of all sorts that have been affected by COVID-19, but we're really trying to reach in and impact those businesses that had to shut early and are in that moment now of considering reopening. They've done innovative things like curbside delivery or takeout, and those are the ones that we're really trying to help move forward and get restarted in this moment.
Thank you, Mark. Now to Bob Haig from Wisconsin Radio Network. Bob?
Hi. Yesterday on Upfront, the governor said it would be his preference that everyone wear a mask when we're out and about. And with the understanding that WEDC can only make recommendations about masking, how concerned should folks be about going into grocery stores or other retailers that are not strictly enforcing masks for employees and customers?
Well, I think it's a big deal. And of course, it's not something we can require, nor do we have face mask police out there checking on this. But I feel very confident people of Wisconsin get it, how important having masks are. And just, I'm sure personally, many people would, if they feel discomfort, that then they should not participate in shopping at that store.
Thank you, Bob. And our final question this afternoon belongs to Amy Reed from WISC TV in Madison. Amy?
Hey, thanks for sticking around for this. Governor, what message do you think it sends to Democrats and Republicans in the legislature, and what message do you think it sends to voters that the administration has essentially given up trying to quickly develop a new statewide response?
Well, yeah, I'm disappointed too, but this happened with the Supreme Court, 4 judges in the Supreme Court making their decision. And it's clear because they made it clear. The Republicans are not interested in a statewide approach, and they're not interested in restrictions such as limiting the number of people in different facilities at different times. So given that, we're not giving up. We have spent 90% of our time since this began making sure that we have the proper equipment in order for our frontline workers to continue to do their job. We've spent the same percentage of time making sure that we are doing testing appropriately all across the state of Wisconsin. And we spent 90% of our time, and now we'll spend 100% of our time making sure that contact tracing is in place. So those are not small things, believe me. Those are, frankly, the most public and most important public health things. Do I wish we had a different outcome? Hell yes. The Supreme Court took care of that, and they're the court of the land, and we will move on in an appropriate way. We will continue to have conversations with the Republicans and the Democrats going forward on a whole number of things. But clearly, they're not going to be, unless the Republicans change their mind, which they see no interest in doing so, and that is not a surprise to me. That's been their position all along. So we will move forward as a state and beat this virus through the mechanisms that we have in place.
Thank you, Amy, and thank you all for joining us for today's briefing. Please continue to monitor the DHS Outbreaks and Investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, Wisconsin Economic Development Corporation, and the Department of Children and Families. Thank you, and have a good afternoon.